50-question CNA practice. Flashcard 1. The resident requires blank precautions for tuberculosis A. Standard B. Contact C. Droplet D. Airborne. Think of the answer before the reveal. The answer is D. Airborne. Flashcard 2. Tuberculosis is defined as A viral infection that is similar to the common cold. B. A bacterial infection that affects the lungs. C. A fungal infection that causes inflammation to the liver. D. An antibiotic-resistant infection that is colonized. Think of the answer before the reveal. The answer is B. A bacterial infection that affects the lungs. Flashcard 3. While caring for the resident, he begins to choke. After calling the nurse and staying with the resident, the nurse aide should A. Start abdominal thrusts. B. Document the findings. C. Ask the resident if he can speak or cough. D. Place a fist halfway between the resident's rib cage and waist. Think of the answer before the reveal. The answer is C. Ask the resident if he can speak or cough. Flashcard 4. Mr. Snyder is 88 years old. He has tuberculosis and is disoriented. Mr. Snyder's disorientation means he has decreased cognitive function. B. Is alert and oriented. C. Paralyzed on one side of the body. D. Requires droplet precautions. Think of the answer before the reveal. The answer is A. Has decreased cognitive function. Flashcard 5. The resident asks the nurse aide to view the facility's survey results. The best response by the nurse aide is A. You don't need to look at that right now. B. Why do you want to see that? You won't understand what you're reading. C. Those results can be seen after you sign a release to view them. D. Do you have a specific question I can answer for you? Think of the answer before the reveal. The answer is D. Do you have a specific question I can answer for you? Flashcard 6. The resident states his daughter is only mean to him when he asks too many questions. This is an example of A. Rationalization. B. Displacement. C. Denial. D. Misappropriation. Think of the answer before the reveal. The answer is A. Rationalization. Flashcard 7. Which vital sign should be reported to the licensed nurse immediately? A. Blood pressure 138/88 mmHg. Respiratory rate 28 breaths per minute. C. Oral temperature 99.1 FD. Pulse rate 99 beats per minute. Think of the answer before the reveal. The answer is B. Respiratory rate 28 breaths per minute. Flashcard 8. When checking the resident's pulse rate, the nurse aide will observe the blank. A. Rate, regularity, sound. B. Rhythm, sound, force. C. Rate, rhythm, force. D. Rate, rhythm, characteristics. Think of the answer before the reveal. The answer is C. Rate, rhythm, force. Flashcard 9. Maintaining proper body alignment while the resident is lying in bed will help to A. Prevent contractures. B. Restrain the resident. C. Decrease risk of fall. And D. Stop blood clots from forming. Think of the answer before the reveal. The answer is A. Prevent contractures. Flashcard 10. When transferring the resident from the bed to the chair, all actions are appropriate except A. Place non-skid footwear on the resident. B. Place the resident in lateral position. C. Place the bed in the lowest position. D. Position the chair to the resident's unaffected side. Think of the answer before the reveal. The answer is B. Place the resident in lateral position. Flashcard 11. When caring for the resident with C. diff, the nurse aide should remember to A. Use sanitizing gel to hand hygiene before and after resident contact. B. Use airborne precautions before entering the resident's room. C. Only use standard precautions when caring for the resident. D. Hand hygiene using soap and water. Think of the answer before the reveal. The answer is D. Hand hygiene using soap and water. Flashcard 12. The resident who is bedbound should be repositioned every 30 minutes. B. Hour. C. 2 hours. D. Day. Think of the answer before the reveal. The answer is C. 2 hours. Flashcard 13. The resident who needs assistance with eating should be placed in the blank position as supine. B. Lateral. C. Prone. D. Semi-Fowlers. Think of the answer before the reveal. The answer is D. Semi-Fowlers. Flashcard 14. In the chain of infection link, the blank describes the person who could become infected. A mode of transmission. B. Portal of exit. C. Susceptible host. D. Causative agent. Think of the answer before the reveal. The answer is C. Susceptible host. Flashcard 15. The resident was recently found to have pediculosis. This will require blank precautions. A. Airborne. B. Contact. C. Droplet. D. Standard. Think of the answer before the reveal. The answer is B. Contact. Flashcard 16. The resident needs a breathing treatment. Which member of the healthcare team will assist? A. Respiratory therapist. B. Speech therapist. C. Occupational therapist. D. Social worker. Think of the answer before the reveal. The answer is A. Respiratory therapist. Flashcard 17. The nurse aide is allowed to perform which action? A. Pause an alarming IV pump. B. Rub medicated ointment on the resident's skin. C. Remove a nasogastric tube. D. Observe the resident for signs of infection. Think of the answer before the reveal. The answer is D. Observe the resident for signs of infection. Flashcard 18. All of the following are risk factors for falls except a medication. B. Gait problems. C. Urinary frequency. D. Non-skid footwear. Think of the answer before the reveal. The answer is D. Non-skid footwear. Flashcard 19. Which resident has a higher risk for choking? A. The resident who is alert and oriented. B. The resident with cognitive impairment. C. The resident who swallows without difficulty. D. The resident who ambulates without assistance. Think of the answer before the reveal. The answer is B. The resident with cognitive impairment. Flashcard 20. The best way to prevent the spread of infection is a. Following precaution guidelines. B. Performing hand hygiene. C. Using standard precautions. D. Wearing gloves. Think of the answer before the reveal. The answer is B. Performing hand hygiene. Flashcard 21. When assisting the resident with a bed bath, the nurse aide should A. Gather supplies after raising the bed to working height. B. Remove all clothing and linen before starting the procedure. C. Observe the resident's skin for bruises, rashes, and open areas. D. Transport the resident to the shower using a trolley lift. Think of the answer before the reveal. The answer is C. Observe the resident's skin for bruises, rashes, and open areas. Flashcard 22. Which action is appropriate when assisting the resident with bed bath and perineal care? A. Cleanse legs and feet first, then chest and arms. B. Change bath water and gloves after washing legs and feet. C. Avoid washing the perineum area. D. Wipe the perineum area from back to front. Think of the answer before the reveal. The answer is B. Change bath water and gloves after washing legs and feet. Flashcard 23. The best position for reducing pressure on one side of the body is a. Supine. B. Fowlers. C. Semi-Fowlers. D. Lateral. Think of the answer before the reveal. The answer is D. Lateral. Flashcard 24. The resident's head of bed is elevated 38 degrees. The resident is in the blank position. A. Semi-Fowlers. B. Fowlers. C. Supine. D. Lateral. Think of the answer before the reveal. The answer is a. Semi-Fowlers. Flashcard 25. The nurse aide is using proper body mechanics if he A. Pivots the client from one surface to another. B. Lifts and twists at the same time during resident transfer. C. Bend at the waist to assist the resident to stand. D. Assist the resident to transfer with feet as close together as possible. Think of the answer before the reveal. The answer is A. Pivots the client from one surface to another. Flashcard 26. To measure the height for the resident who cannot get out bed and who lays flat, the nurse aide will A. Position resident supine and measure from top of head to bottom of feet. B. Position resident lateral and measure from top of feet to bottom of feet. C. Measure along the curves of the spine. D. Use the mechanical lift to position resident on the standing scale. Think of the answer before the reveal. The answer is A. Position resident supine and measure from top of head to bottom of feet. Flashcard 27. The nurse aide will use a blank to measure the height of a resident who is bedbound. A ruler. B. Abduction pillow. C. Tape measure. D. Lift. Think of the answer before the reveal. The answer is C. Tape measure. Flashcard 28. When transferring the resident from the bed to stretcher, the nurse aide should A. Unlock the bed wheels prior to the transfer. B. Undrape the resident during the transfer. C. Remove the urethral catheter prior to transfer. D. Seek the assistance of one additional coworker. Think of the answer before the reveal. The answer is D. Seek the assistance of one additional coworker. Flashcard 29. The resident laying with head of bed flat is in the blank position. A lateral. B. Supine. C. Semi-Fowlers. D. Fowlers. Think of the answer before the reveal. The answer is B. Supine. Flashcard 30. Which position is best for the resident who has difficulty breathing? A. Fowlers. B. Supine. C. Lateral. D. None of the above. E. All of the above. Think of the answer before the reveal. The answer is A. Fowlers. Flashcard 31. Which device is appropriate to use for the resident with an unsteady gait? A. Abduction pillow. B. Knee immobilizer. C. Gait belt. D. Hydraulic lift. Think of the answer before the reveal. The answer is C. Gait belt. Flashcard 32. When assisting the resident with a walker, the nurse aide should A. Stand slightly behind the resident on the right side. B. Place the walker as far from the resident as possible. C. Check for dizziness after assisting the resident to stand. D. Ask resident to step toward walker with right leg first, then left. Think of the answer before the reveal. The answer is C. Check for dizziness after assisting the resident to stand. Flashcard 33. Turning the resident without disturbing body alignment is known as A. Log rolling. B. Transferring. C. Ambulation. D. Pivoting. Think of the answer before the reveal. The answer is A. Log rolling. Flashcard 34. While assisting the resident with a walker, she begins to fall. The nurse aide should A. Try to break the fall by catching the resident. B. Position the resident in lateral position while waiting on the nurse to arrive. C. Leave any bleeding areas open until the licensed nurse arrives. D. Check if resident is breathing. Think of the answer before the reveal. The answer is D. Check if resident is breathing. Flashcard 35. A fire occurs while caring for the resident. The nurse aide should A. Lock all doors and close all windows. B. Remove residents using the elevators. C. Activate the fire alarm. D. Remove non-ambulatory residents first. Think of the answer before the reveal. The answer is C. Activate the fire alarm. Flashcard 36. The nurse aide needs to check the resident's blood pressure. She should locate the blank pulse point. A. Apical. B. Brachial. C. Carotid. D. Radial. Think of the answer before the reveal. The answer is B. Brachial. Flashcard 37. When weighing the resident, the nurse aide will A. Zero the scale after weighing the resident. B. Weigh the resident at different times each day. C. Ignore manufacturer's instructions for operating the scale. D. Subtract the weight of the wheelchair from the total if applicable. Think of the answer before the reveal. The answer is D. Subtract the weight of the wheelchair from the total if applicable. Flashcard 38. The resident must receive a special diet. Which member of the healthcare team will assist? A. Speech therapist. B. Social worker. C. Registered dietitian. D. Registered nurse. Think of the answer before the reveal. The answer is C. Registered dietitian. Flashcard 39. The nurse aide finds the resident crying in her room. Which response is most appropriate? A. I'll come back when you're feeling better. B. Don't cry, everything will be okay. C. Why are you crying now? D. Is there something you want to talk about? Think of the answer before the reveal. The answer is D. Is there something you want to talk about? Flashcard 40. The licensed nurse has instructed you to check the resident's axillary temperature. To complete this task, you will position the thermometer A. Under the resident's tongue. B. In the resident's ear. C. In the resident's rectum. D. In the resident's underarm. Think of the answer before the reveal. The answer is D. In the resident's underarm. Flashcard 41. Which vital sign is affected by the resident's hypertension? A. Blood pressure. B. Pulse rate. C. Respiratory rate. D. Temperature. Think of the answer before the reveal. The answer is A. Blood pressure. Flashcard 42. When assisting the resident to ambulate, all the following equipment may be necessary except a gait belt, B. Non-skid footwear, C. Knee immobilizer, D. Assistive device. Think of the answer before the reveal. The answer is C. Knee immobilizer. Flashcard 43. When performing a procedure that may cause blood splash, the nurse aide should use blank precautions as standard, B. Contact, C. Droplet, D. Airborne. Think of the answer before the reveal. The answer is B. Contact. Flashcard 44. Which statement is an example of subjective information? A. There's a red rash to the resident's left upper arm. B. The resident's breath smells like alcohol. C. The resident's heart rate is 88 beats per minute. D. The resident complains of nausea. Think of the answer before the reveal. The answer is D. The resident complains of nausea. Flashcard 45. Which infectious disease requires droplet precaution? A. Tuberculosis, B. Scabies, C. Pediculosis, D. Influenza. Think of the answer before the reveal. The answer is D. Influenza. Flashcard 46. Which infection disease is characterized by yellow discoloration of the skin, jaundice? A. Hepatitis B. Scabies, C. MRSA, D. Tuberculosis. Think of the answer before the reveal. The answer is A. Hepatitis. Flashcard 47. Which infectious disease is characterized by watery diarrhea? A. Brie, B. Clostridium difficile, C. MRSA, D. Pediculosis. Think of the answer before the reveal. The answer is B. Clostridium difficile. Flashcard 48. Which action is appropriate infection control practice? A. Carrying linen by holding against your uniform. B. Dragging dirty linen across the floor. C. Performing hand hygiene after touching the resident's side rails. D. Disposing of blood-soiled supplies in the regular trash bag. Think of the answer before the reveal. The answer is C. Performing hand hygiene after touching the resident's side rails. Flashcard 49. Which sequence is correct when putting on personal protective equipment, PPE? A. Gloves, mask, goggles, gown. B. Gown, mask, goggles, gloves. C. Gown, goggles, mask, gloves. D. Gloves, gown, mask, goggles. Think of the answer before the reveal. The answer is B. Gown, mask, goggles, gloves. Flashcard 50. When using a mask, the nurse aide should remember to A. Change the mask if the procedure takes more than 20 minutes. B. Remove the mask by grabbing the outside of the mask, then the straps. C. Perform hand hygiene before removing the mask. D. Leave the mask in place if it becomes soiled or damp. Think of the answer before the reveal. The answer is C. Perform hand hygiene before removing the mask.